tooth replacement can be done using two different types of prosthesis: fixed and removable. Fixed prosthesis, as its name suggests, are placed in the patient's mouth and would not be removed. These fixed restorations can be implant-supported or tooth-supported. On the other hand, removable prosthesis can be removed and, like the fixed ones, can be tooth-supported or implant-supported. Depending on the type of rehabilitation, we may use one sort or another of impression material. The most commonly used in these days are addition silicone and alginate. Addition silicone is used in almost all types of prosthesis rehabilitation, whereas alginate is mainly used for study models or for the fabrication of simple removable prostheses. To mix alginate, we must always follow the manufacturer's directions. In this particular case, we have ProClinic's alginate. ProClinic recommends that we use 2 scoops of alginate and 2 of water. We mix it strongly until we get a relatively thick mixture. We fill the tray with the alginate and we start placing it in the patient's mouth. We should place the tray, seating it from the back to the front to avoid too much alginate flowing down the throat. Alginate setting time is approximately from 2 to 3 minutes. We should always test if the setting is correct before removing the tray. We remove the tray from the patient's mouth. We must ensure that the alginate is humid in order to achieve a correct cast, because alginate always undergoes a contraction process in absence of humidity. Addition silicones are mainly used for the impression of fixed prosthesis. There are 2 types of putty, heavy and light. Light putty is usually injected with a special gun. Heavy putty has 2 components, base and catalyst. They should be mixed in equal amounts and always without gloves, to avoid any latex or talc component interfering with the correct setting of the putty. Working time is approximately 30 to 40 seconds. We put the silicone in the tray and we should remove all surpluses. We can put some fluid silicone, particularly at the area that we would like best impressed. We proceed to place the tray in the mouth. As with alginate, we make some pressure from the back to the front to avoid the material flowing down the throat. Setting time of addition silicones is approximately 5 to 6 minutes. After checking the correct setting of the material, we remove the tray from the mouth in a single movement. Contrary to alginate, addition silicone does not need humidity to preserve its shape, so there is low dimensional change. Once we have taken the 2 impressions of the patient, upper and lower, we should be able to correlate the 2 models between them. Thus, we are going to make a bite registration, in this case with a biting silicone. We place it on the occlusal surfaces of the teeth and ask the patient to close the mouth in maximum intercuspidation. Silicone for bite registration has a faster setting than addition silicone or alginate. Setting time is approximately 30 seconds to 1 minute. Another material with which we can make an intermaxillary registration is wax. We soften the wax and place it in the mouth, asking the patient to bite strongly.
Hacia adelante y atrás. Ahora aquí. Hazlo rápido porque si no se endurece muy rápido. Y adelante. Ya. ¿Ve? Ce n'è pas solo. Parte fuori, parte fuori. Perfectamente. Io aguanto.